than that. And as a parent now, I can tell you, as my kids came on, I kind of figured out, boy, your genes can do a whole lot of different things. And look at your siblings. I don't know how you feel about that, but somehow it's pretty remarkable. And then something happens in the environment. There's some trigger or host of triggers, and we're trying to, yeah, here's a question. I'm going to tell you. So that was the question of what is the latest hypothesis on what the environmental triggers are. So those triggers are everywhere. We are all likely exposed to those triggers, and for some reason, in some people with those genes, they turn on the diabetes process. Now it turns out that identical twins, what do identical twins have? Identical genes. What's the rate that two identical twins will both have diabetes? No, less than 70. Probably 50. So even with same genes, looks like same environment, they don't both end up with diabetes. Yes? Is an identical twin? Yeah. Well, there you go. You're what we call concordant, and I have lots of twins in my practice who are what we call discordant, and they both don't have it. So what are these triggers? These triggers are likely have to do with exposure to substances in food. So one of the things supposedly that helps is having been breastfed, and then when you get introduced to gluten. So it seems like you could get too early, before 4 months, maybe too soon. After 8 months, if you've never had gluten, it may be too late. So kind of a U shape in the risk. But you know what? We all got gluten, and many of my patients all were breastfed, or they weren't breastfed, or whatever. So there's more than just that. And now one of the big things that we're thinking about also are viruses. They're everywhere. And in addition, vitamins. So vitamin D, maybe people who get either type 1 or type 2 diabetes may not have had enough vitamin D. So one of the recommendations for women when they're pregnant and they have a risk of type 1 diabetes for that baby to take more vitamin D. Maybe you need more omega fatty acids. But one of the other things is, you know, there's lots of bacteria in and on all of us, and viruses, and actually all kinds of microorganisms. It turns out that inside the guts of people with type 1 diabetes, their microorganisms might be a little different, and that those microorganisms may process things in the environment that promote more diabetes as a slight risk factor. Where do those bacteria and microorganisms come from? From your mother, your father, your environment, and you've got no control over what those are. So I actually chair for the National Institutes of Health a study called TEDDY. I chair their oversight committee. They're following 8,000 babies who have genetic risk for type 1 diabetes, either the siblings of somebody with type 1 or the family members, or in addition, just people from the general population. Those babies they're now following, so they're following them in Finland, in Sweden, in Germany, and in the United States. Every month for the first 4 years, they get poop from each one of these babies. 4 years. Every month, that's a lot of poop. They're taking their hair, their nails, the water they drank, all the food they ever got, every infection they ever got, and they're trying to figure out what the environmental triggers are. This study will take 20 years. So far, of those 8,000 children, they've already got 400 with antibodies, and they got over 100 with diabetes. So they're getting some data, and and it's still going